You're listening to the Mother-to-Baby podcast, medications and more during pregnancy and breastfeeding. Ask the experts with your host, genetic counselor and mom of four, Chris Dahlman.
This episode contains evidence-based information that's current as of the day recorded and may change as more data becomes available. To get the very latest information about this topic or other topics in pregnancy and breastfeeding, please contact a mother-to-baby specialist at 866-626-6847, by text at 855-999-3525, or through our website at MotherToBaby.org. Welcome to another episode of the Mother-to-Baby podcast. My name is Chris Dahlman, and I am a genetic counselor, a mom of four, and a teratogen information specialist. So what that means is that I talk to people, so patients, family members, healthcare providers, about exposures that can happen before pregnancy, during pregnancy, while breastfeeding, and in cases of adoption. And an exposure can be anything. So it could be a medication or a vaccine or something that you work with. Our guest here today is going to talk with us about the importance of diversity in pregnancy research and advocating for oneself when it comes to healthcare. Dr. Kiara King is a board-certified obstetrician gynecologist with a huge social media following, particularly on Instagram at Dr. Kiara King, where she delivers health and wellness information with a bit of style thrown in the mix. In addition to being a skilled physician and surgeon, she has a lifelong passion for fashion, beauty, and healthy living. Dr. King, welcome to the show.
Thank you so much for having me, Chris. It's a pleasure.
It's our pleasure as well. So can you just jump right in and tell our audience about your work and why it is so meaningful?
Well, I hope it's meaningful. For years when I was in the clinical setting, I found myself, educating quite a bit and finding that patients were often not getting high quality education in the office. That was just my personal perspective. Obviously, there are tons of physicians out there doing amazing jobs.
Sure.
But I wanted to make sure that when patients left the office setting, that not necessarily that they didn't have any questions, because certainly things could arise later on, but that they had a good understanding about what we discussed. They felt comfortable about what we discussed in terms of the plan. And so I found myself often sharing very similar education points. For prenatal visits, you see, 4 or 5 people that are 28 weeks back to back, you're telling them pretty much the same thing. And even for gynecologic patients. And so I remember several years ago thinking, I would love to be able to impact more people all at once. And yes, it's fantastic to see one person, every 15 to 20 minutes. But, I'm often delivering the same message over and over. So I would love for this to be something that I could do. And so I found my way, onto social media several years back, kind of unintentionally. Like, it wasn't my intention to grow a platform or to become a content creator or anything like that. But I just wanted to, I was actually on maternity leave at the time, and I wanted to be able to still provide some information. And I was a new mom. And so I said, what can I talk about? Motherhood. I can talk about wellness. I can talk about fashion. And so that's really where it all began. But in terms of it being meaningful, it means the world to me that I can connect with so many people all at once and that they find the information beneficial. That's really what it's all about. Even if it's one people, usually it's more than one person. But even if it's just one person that says, after watching a video on self-breast examination or self-breast awareness, that they're like, I found a lump and I'm going in today. Or I'm going, I called and made an appointment. And so that's where the meaning is for me, is providing education and information that people can actually use take back to their own healthcare providers or do additional research so that they can better, optimize their lives.
I cannot agree more about the importance of the education piece. As you say, folks are out there, they're doing the very best that they can, but people learn in different ways. People uptake in different ways. And if you're reaching a wide audience through even one person through social media, that's an excellent use of the platform. So,
yeah, agreed.
Which,
Agreed.
That also can be a bit dicey. But when did you realize your audience was growing substantially on social media, giving you a chance to really spread the information that is important and that can make an impact?
It was something that I really just kind of happened upon, like I said, when I was on maternity leave. And it wasn't ever something that I was like, I've got to grow my platform to 100,000 followers or to, any particular number. One of my main goals was just always to put out information and content that I liked and enjoyed, and that I felt that people would learn from, and could, take home little tidbits of information from. So I can't really say like, oh, I noticed exactly when. To be honest, it's kind of one of those slow and steady things. I've just gradually accumulated and attracted, followers over the years. And like I said, that my goal has always just been to give sound, reliable information, especially in the healthcare space, because I share information about fashion, which someone may find that reliable or not. But certainly I can provide sound medical information and break it down in a relatable way. And I think to me, that's what's, most important. I haven't really focused on like growing specifically in terms of numerical value, but more on, let me make sure I'm giving high quality information. Let me make sure, let me read up on this really quick and make sure that the statistic I'm going to share is, pretty accurate.
So making the information as easy to understand as possible and getting it to the greatest audience you can. I absolutely understand that. I think that's such a cool thing. So when you realized, that your following was growing, right? My guess, and please correct me if I'm wrong, it gave you a sense of satisfaction, again, not about the numbers, but about the fact that the reach was growing, that the messages that you wanted to share were getting out to folks, and folks were interested in coming back for more. My guess is that felt pretty good, right? Because it took from where you started and just sort of opened it up to a much bigger group.
Yeah, I mean, sure. It definitely, being able to get a message out to people that are interested in that message is always a good thing. And I get feedback all the time, like, thank you so much. You always make this information relatable and easy to understand. And so again, that's where it is for me. And so if I can do that for more people, then the better.
Absolutely. So let's switch gears a little bit. MotherToBaby uses evidence-based information through observational research in order to get the information that we can then provide to people who are pregnant, looking to become pregnant, breastfeeding, and so on, as well as healthcare providers. Now, as a field, so in medicine in general, it is known, it is in the data, that diverse representation in clinical research can be a challenge and is a challenge. But why? Can you touch on reasons why there are large groups of people who still are often underrepresented in clinical research?
I think there are probably a number of reasons. I think historically, I can speak from, the Black American perspective. There are a lot of things that are factoring in to those decisions. Many people have heard of the Tuskegee syphilis study. For those who are unfamiliar, it was a very nefarious study that was enacted by the United States government. And so when we talk about institutional racism, systemic racism, we're talking about things that are built into the fabric of our society. And so essentially what happened in this study, you had the US government withhold treatment from a group of Black men who were infected with syphilis, not for months, a year. It was for essentially 3 to 4 decades. Early on, there was no known treatment for syphilis, but over the course of time, and actually, if I'm not mistaken, roughly 10 years into the study, penicillin became available, and they continued to withhold treatment from these men. Those men went on to infect their wives, who ultimately, some of them had children with congenital syphilis, which, as you know, is quite deleterious to development. And so the Tuskegee syphilis study, which obviously that was a very kind of brief synopsis of it, but still sticks out in many people's minds. There are many Black men to this day who don't want to go to the doctor because they are not trusting of the medical system. And so I have always, said, even in my training, whether it was med school or residency and far beyond, that when patients come and, you'll see people write it in their charts, patient non-compliant with care. Why are they non-compliant? Have we asked them what's going on? Have we asked, do they have, the finances to pay for their medications that they didn't pick up? Are they really truly just like, I have my medication right here and I'm just choosing not to take it? Are they scared to come to a physician's visit, even though you told them we need to see you back in 3 months? Are they apprehensive? We have to get down and meet people where they are and truly try to understand what's going on and why there may be some apprehensions, whether it's coming just for general medical care or whether it's for, participating in medical research. But again, the Tuskegee syphilis study was not by far the first of its kind in the United States. In fact, medical research really started here in this country during enslavement. And so it goes back, again, we talk about institutional systemic racism. It goes back and it has been embedded in the fabric of society. And so we have to realize that there may be many apprehensions to participating. I had someone, this was a couple of years ago, but I had a mom reach out to me on social media about her daughter. And she said, I'm not sure if she should take this medication. I know they try and do research, doing research studies on people. This was like 3 or 4 years ago. And it was a pretty well-known medication that people have been using for years. And so we have to consider all of the cultural, societal implications of asking people to willingly use their body for medical research, and understand that some people may want to advance, technology and science by participating, and that some people are simply going to be unwilling. It's unfortunate because we have to look at the flip side of that, where we may not have data that accurately reflects all of, the diverse backgrounds and ethnicities because of that. But I think that's just something we have to deal with.
So actually, you segued beautifully into the next question. So as you said, sometimes we won't have the data available needed in certain populations if we haven't had participation in the research. So why is diversity in all clinical research, and focusing specifically on pregnancy, why is that diversity so important?
Well, I think anytime we have objective data about medications or any other types of treatments, it's going to allow us to better tailor treatments and plans for each individual patient. If you have a medication that has only been studied in one very specific subset of pregnancy or of society, then that data can only more accurately reflect that that group. And mind you, maybe it could, be kind of extrapolated, into other populations. But certainly the more accurate, the data, set will be from a particular group of people, the better we can do that. You know what I mean?
Absolutely.
If we're looking at, some medication in a group of bears, that probably won't translate as well to a group of snakes, but maybe some things will work out okay. And so I think that we have to ideally, just be as transparent as we possibly can be. There has to be transparency. There has to be an understanding, and again, a willingness to educate people on what medical research is, why it exists, and why it's important to them. Again, you're still going to have people that are not interested in participating, but you may have more people that are willing when they understand, oh, this can potentially impact me or my children or my grandchildren down the line in terms of how we look at pregnancy or how we manage pregnancy or whatever other clinical condition there may be.
Absolutely. And I would go a step further. And really, as your answers have implied, consenting certainly, but also consenting with compassion and educating with compassion and realizing, hey, there's a lot in the past here, and a lot of it that's not quite so past. There's a lot going on.
Absolutely.
And we are not, woo, that is Absolutely. Beyond. Yeah, I'm not trying to be off the airwaves. But there's a lot going on, and being mindful that, every day is can be a challenge and a struggle, after COVID and everything. And as healthcare providers, as researchers, saying, we know what we need. How are we going to be able to give information to folks to allow them to choose? Because as you said, there are going to be people who aren't interested. That is absolutely fine. As long as we are still trying to make those efforts in a way that is available for people to understand and want to accept or reject. And I appreciate that. I appreciate you saying, we have a long way to go in medicine and research, and we need to be mindful, and we need to have that compassion.
Absolutely.
So thinking about self-advocacy, I know that you are huge when it comes to people advocating for themselves in healthcare. And we do encourage patients to advocate for themselves, certainly. Can you speak a little bit more about that? And again, why it's important and how folks can do that effectively?
Absolutely. So, as many of us know, medicine, or you may not know, medicine historically was a very paternalistic environment. People would come to the doctor and they would sit down and just sit there and listen, and they would be told a diagnosis, and they would be told what was going to be done, and they would be told the next steps. And it wasn't really a collaborative effort so much. And many people still have that mindset today where they are coming to the doctor is this authority figure, and they're going to get the information from the doctor, which generally is not necessarily a bad thing. But we have to understand that works okay if we have doctors that are culturally competent, compassionate, empathetic, and truly invested in educating patients. If you're lacking any of those, and if you're not desiring your patients to have autonomy, it's not going to look so good. And so I always tell patients, this is your body. This is your health. This is your health. This is your set of healthcare decisions, and you get to decide for you. Ideally, that's in conjunction with a provider, a physician, maybe a nurse practitioner, a midwife, depending on, what the realm of clinical care you're in. Ideally, that's in conjunction with them. But I've had people that are kind of apologetic for asking questions, which lets me know that probably at some point in time it wasn't looked on too favorably for them to ask questions, whether they were dismissed, whether they were rushed along, or any other, behavior towards them that made them think they needed to say, "I'm really sorry, Dr. King, but I have questions." And I typically look at them like, that's exactly what you're here for. Of course, you have questions, have all of the questions. And so I think we have to, again, address patients where they are and be the ones to take the first steps, not assuming that everything I just told you they completely understand. Asking, do you have any questions? Does this all make sense? Is there anything else that you thought of? Because patients will say, "Oh, well, could you tell me that one more time?" Or, "Can I call my mom and you can tell her that too? Because I might forget once I get home." And I get it, but people also, so going back to the advocacy part, people have to understand that that is okay for them to do. And because of how medicine has been historically, there are many people that don't realize that that's okay to do. I truly believe more and more now, obviously with the advent of social media, people are able to spread their stories and say, "I went to the doctor and I asked about this." And so I think that empowers people, which I think is fantastic. But just making sure that patients know, one, again, it's your body. If it wasn't for you coming to see myself or other physicians, like, I wouldn't have a job. I wouldn't have a career. So it's your body. You get to ask questions. You get to use your voice. Both of those things are okay. And if someone makes you feel like that's not okay, you probably want to find a new physician or healthcare provider, whoever you're happening to be seeing at the time, because you only get one body, and you have to be comfortable with the decisions that you make for your body. And if you're not, that's a problem, because I can leave from a clinical setting and go home and have a fantastic life. But if you're at home worrying, you're not understanding something, you're confused, there's no clarity, what good did that visit do when you were in the office? So again, making sure that people are educated on the fact that they do have a voice, that they can advocate for themselves, I think is the first most important step.
And I think it can be tough sometimes, right? Because as you said, there's certainly some parental feeling in medicine over time. And there are folks, many folks, unfortunately, who have been dismissed for various reasons. When I think of, if I had to give an example of who might be dismissed in healthcare, what I automatically think of is a biological female of reproductive age and potential in pain. There's been lots of people in pain. I've been in pain before, and, I live in a bigger body, and I always have. And the answer was, well, maybe if you just lost a little weight, move a little more, your pain will go away. And that's not always the case. And I do appreciate you mentioning that sometimes advocating for yourself means switching providers to someone who is going to listen to you, because you do deserve to be heard and treated and cared for.
Absolutely. And I have personally told patients, get a second opinion. Like, you need to see a physician, a doctor, a nurse. Like, there should be no ego involved. Like, my ego should not be in the way of your healthcare, period. Like plain and simple. I have told people, go get a second opinion. Maybe they're going to tell you, and they probably will tell you very similar things that I told you, because a lot of times, what we're discussing for me is very bread and butter. Like, this is very, someone's coming in with a particular, concern, and it's a pretty straightforward concern. But for them, it's not straightforward, because it's not something they've necessarily, delved into and studied for a really long time. Right. But it's their body, and they know it doesn't feel great, which is ultimately equally important. And so I tell them, look, and I really literally will tell them, you get one body. You have to be comfortable with the decisions you make for your body. If you want to go get a second opinion, it is not offending me. Like, because if they tell you the same thing, then you may say, okay, that's exactly what Dr. King said. I want to go back to her, or I don't want to go back to her. I'm just going to stick with this person. Or maybe they'll tell you something different. Maybe they will give you a new piece of information that helps you make a decision. But knowing that you have the ability to do that, again, is what's important. Whether they go and do it or not, they may say, no, I'll just stay here. That's fine. But again, I think, just having the awareness. We say oftentimes in medicine, like, you don't know what you don't know. And if you've never heard of something, you're not aware of something, how do you know to look after it or seek it or go find more information on it if it's not something that's even in your awareness? And so just giving people permission to use their voice, ask questions, go seek a second opinion can be very powerful and impactful, because those may be options that people didn't realize they had.
Absolutely. Whether they were expressly told or not, there is some pressure not to take up space with questions, with time, sometimes with appointments. As you say, sometimes people don't even go. It's like, nah, it doesn't hurt that much, or I'm not that worried, or there's not a lot of time, or whatever it is. And, there's a larger fear there of not being taken seriously, not being heard. And then, you spend all this time and effort. So yeah. It's such a good reminder, again, not only that, you can take up space, but that you deserve to take up space. You deserve to ask questions in a safe place and get full answers that you can use. And absolutely, Dr. King, thank you so much for that. Before we let you go, is there a final thought you would like to leave our audience with?
This has been my mantra for a while, but I always tell people education is empowerment. And I think, we've kind of covered that in many ways, with, the discussion that we've just had. But education is empowerment. Whether you choose to take that information and move it forward in one way or the other, having access to the information and being able to discuss the information in a way that is beneficial to you and your health is empowering. And patients should know that, that education is empowerment. Whether you're getting information from, I always say, get information from reliable sources.
Yes.
That too is important, because not every source is a reliable source. Sometimes sources are personal opinions and experiences, which are absolutely valid, but that goes back to the whole data and research aspect, that an N of one is not necessarily going to translate into, reproducible results, which is the whole point of research and data. And so while, singular, case studies, if you will, of someone's blog on the internet is valid, it may not be representative of other people.
Yes.
And so we really want to make sure we're using quality information and educational resources so that you can feel empowered to go forth and live your best life.
That would actually be something we would love to hear you talk more on, maybe on a future episode, how to navigate some of these resources and social media information. Also, how do you know, how do any of us know what we can rely on? So
yes, absolutely.
Thank you again for being with us today. And thank you so much for all of this valuable information. We will see you online, certainly Instagram at Dr. Kiara King, which will also be in the show notes.
Absolutely. Thank you so much for having me. I appreciate it.
Our pleasure. And that's going to do it for this episode of the Mother to Baby podcast. Be sure to hit that subscribe button so that way you never miss a new episode, and you can go back and listen or re-listen to some of those older episodes as well. You can find us on iTunes, Spotify, Audible, or however you like to listen to podcasts. And if you want to be on the podcast, or if you have an idea for the show, we would love to hear from you. Please feel free to email us at contactus@mothertobaby.org. And Mother to Baby is here to answer your questions about exposures before and during pregnancy, while breastfeeding, or if you have questions about exposures and adoption. You can reach us by phone at 866-626-6847, by text at 855-999-3525, You can visit us on our website, MotherToBaby.org, and there you can chat with an information specialist. You can look at our many blogs, information pages, our hundreds of fact sheets that are available free in English and in Spanish. And you can also listen to our podcast or find out how you can participate in our pregnancy studies. If you would like to support the Mother to Baby podcast, as well as all of the ways we get critical pregnancy and breastfeeding health information to you at home, we have a new way to do just that. Encircle is our new monthly giving society that helps ensure we can continue to provide our services at no cost. Join the community today and encircle parents and babies in health. Members will be recognized on the podcast and website. Visit mothertobaby.org/donate today. Until next time, remember, Mother to Baby is here for you. Take care.
Mother to Baby is a service of the nonprofit organization of Teratology Information Specialists and supported by the Health Resources and Service Administration of the U.S. Department of Health and Human Services. It's made possible through generous donations from listeners like you. To learn more about Mother to Baby, please visit mothertobaby.org.